Good evening and thanks for joining us. Across this country for weeks now, Canadians have been banned from visiting their loved ones inside long-term care homes, unable to see for themselves what's going on inside. Now the Canadian military has painted a dreadful picture of conditions inside some of them. The premiers of Ontario and Quebec were so desperate last month, they asked soldiers to deploy into homes unable to cope with COVID-19 outbreaks. Now the military has issued a report into 5 homes in Ontario. The 15-page report contains allegations of terrible neglect and lack of hygiene. Here are just some of them. Little or no disinfection. Significant gross fecal contamination was noted in numerous patient rooms. Nurses, PSWs, often observed not changing PPE for several hours while moving between numerous patient rooms. General culture of fear to use supplies because they cost money. Fluid bags, dressings, gowns, gloves. Forceful feeding observed by staff causing audible choking and aspiration. Patients observed crying for help with staff not responding for 30 minutes to over 2 hours.
The reports they provided us were heartbreaking. They were horrific. It's shocking that this can happen here in Canada.
The Ontario government is responsible for inspecting the facilities, so why did it take the military to expose how grim the situation was? Here's how Premier Ford answered that question.
Yes, inspections happen, but it took the military to be there 24/7 every single day. That's when you find out there's cracks in the system, by living the system around the clock every single day.
Ontario's long-term care minister says her government was working on fixing long-standing cracks in the system, and then the pandemic hit, and the situation, she says, became a full-blown crisis.
COVID tipped the homes that were having difficulties with staffing already right over the edge. Canadians cannot tolerate this. We need all levels of government to come together.
Mercedes Stephenson joins me from Ottawa. Mercedes, why did the military write this report and send it up the chain of command?
Dawna, the Department of National Defence says that the troops raised these concerns because they are trained to report anything that potentially jeopardizes their mission or could harm Canadians who they serve. After an initial report was submitted to Ottawa on May 14th, many troops became concerned as days passed on without action. They were concerned that nothing would be done and vulnerable seniors in these homes with no ability to speak out would face the same disturbing conditions troops allege they found them in. One military source described those conditions as, quote, worse than anything I've seen overseas. Here are just some of the conditions that troops allege they found happening in Ontario care homes. Abuse of residents, falsifying of medical documents, COVID-19 patients not being properly isolated, new workers who were not trained, and a blatant disregard or lack of knowledge of how to wear personal protective equipment and how to execute infection control measures. At Hawthorne Place Care Centre, troops reported a cockroach infestation and forceful feeding that caused residents to audibly choke and aspirate. At Eatonville Care Centre, troops reported alleged abusive and inappropriate treatment of residents, including when changing their incontinence products. Troops report that regular staff at the home stopped them from going into patients' rooms to clean or see patients. At Holland Christian Homes, allegations of abuse and neglect. The military described patients dying in what they called unnecessary pain. Troops also said food was left in a resident's mouth while sleeping and that staff did not help residents to eat, instead writing down that they refused food. All of this is raising concerns for families who have seniors in homes and those who will soon enter those homes themselves about how Canada treats our elderly.
Think of the people living in long-term care now who are seeing this on television, who are still in long-term care, who can't talk to their families, don't have outside interaction. This is just going to add to that anxiety and that concern.
Mercedes, this is agonizing for residents and for family members who can't go inside these homes and be advocates for their loved ones. Premier Ford raised the possibility today of criminal charges and promised accountability and justice. Is that just rhetoric?
Dawna, there is a possibility of criminal charges in at least one of the cases potentially. Of course, these are reports that will have to go to the police who will make those decisions. One example that stood out to us, at Orchard Villa, a patient died, allegedly choking to death after being fed while lying down flat. That's something the troops flagged as being deeply concerning. That incident has now been referred to the coroner's office, and the Premier addressed it today. Others say lack of training is an issue, not just a problem with intentions. And the union tonight pushing back. The union representing workers at two of the care homes that we mentioned say that they welcome the report from the military, but that they have been ringing alarm bells throughout the entire crisis, saying, unfortunately, we've had to fight the provincial government every step of the way to ensure long-term care companies are keeping workers and residents safe.
Mercedes, this report is about 5 homes in Ontario where the military is deployed. They're also in 13 long-term care homes in Quebec, which has had the most deaths from COVID-19. Is there a similar report coming on Quebec?
So I've asked the military, and they haven't said clearly, but I would imagine that there will be a demand to see this, Dawna. People will want to know what's going on there. And keep in mind the larger effect. Right now, there are 39 troops who have been diagnosed with COVID-19, and many more still working in the homes. Dawna?
All right, Mercedes Stephenson in Ottawa, thank you. The first heat wave of the year in Ontario and Quebec is making conditions inside many long-term care homes even more challenging. Temperatures soared to over 30 degrees Celsius today in some places. It's forecast to stay hot for the next few days. Mike Armstrong explains what that means for residents and staff, especially inside older facilities that have no central air conditioning.
When this seniors' residence on Montreal's West Island was built in 1908, air conditioning barely existed. Well, for most of the residents, it still doesn't. Staff tells us it's getting hotter and hotter, and yet the one place to go outside to cool off is off limits.
This is inhumane. I don't know how much I'm going to have to repeat that. It is inhumane, unacceptable.
There are estimates that only 25 to 35% of residents in Quebec long-term care facilities have air conditioning. Newer buildings tend to have central air, but then you also have buildings like this one in Montreal's East End. It's dealt with heat waves, but very rarely in May. This heat wave is hitting very, very early in the season. This building's about 100 years old. It only has a few air conditioners down on this level. When a heat wave normally hits in the summer, there would be dozens of air conditioners sticking out of windows where the residents sleep. That hasn't happened yet. There are dozens and dozens here still in storage. The staff at facilities usually use air-conditioned common areas to cool residents down. That's not always possible right now due to COVID-19 with movement restricted. Even just opening windows and getting air flowing through the building is problematic. They don't want potentially contaminated air passing from one area to another.
It's going to be more complicated this year.
The health minister insists the government has been working on solutions, possibly mobile air conditioners, but says this early heat wave hit before they were ready. Now for staff, a rough situation is getting rougher. They're going through this heat wave in masks, visors, gowns, and gloves.
It's stifling. People under all that protective gear are going to need lots of water and some breaks.
Now this heat wave is also affecting the general public. People without air conditioning are usually told to go to places like malls, those are closed, or community pools. That's not an option right now either. Mike Armstrong, Global News, Montreal.